Assalamualaikum and a very good day. Today we will be presenting about the health status of people with multiple sclerosis in Malaysia. Introduction. Multiple sclerosis or MS is defined as a chronic autoimmune and inflammatory disease of the central nervous system or CNS. Lesion primarily affects the sensory and motor functions of people between the ages of 20 and 40 years old, and this can include cognitive and neurological functions. There are reported disease progression for most people with multiple sclerosis or PWMS, which is highly variable, with prognoses that are commonly uncertain and no general treatment or terminology or management. Whilst the disease is incurable, treatment is still being done to accelerate the patient's recovery from the attack and prevent the disease from getting worse. Because of an uncertain prognosis, the patients experience various physical and psychological disorders that strongly impact their daily performance, social and family life, functional independence, and personal future planning. Viswanathan et al. 2013 stated that MS is an uncommon disease in multiracial Malaysia, with only 1 to 2 individuals affected per 100,000 population. In Malaysia, the prevalence of MS has been on the rise, leading to increased attention on strategies to enhance quality of life or QOL and well-being of individuals living with MS. The research objective of the study was to determine health status of people with multiple sclerosis in Malaysia, and the research question was, what is the health status of people with multiple sclerosis in Malaysia? Study design was cross-sectional study with a sampling method of purposive. The sampling settings were Multiple Sclerosis Society Malaysia and Penang Multiple Sclerosis Support Group. The sample size was the number of PWMS registered to both Multiple Sclerosis Society Malaysia and Penang Multiple Sclerosis Support Group, and is approximately about 150 people. The minimum recommended sample size after calculation is 109. However, due to the limitation of the study, the sample size obtained was 61. Inclusion and exclusion criteria. The inclusion criteria for the study was for people diagnosed with multiple sclerosis, those aged 18 and above. They are currently living in Malaysia, able to read and understand English, and agree to participate in the study. And the exclusion criteria were PWMS who were unable to understand the questions even though assistance was provided, and PWMS who did not reside in Malaysia. There were 2 instruments used in the study. Firstly was the demographic data. First, that looks into the respondents' age, gender, marital status, living location, and age at disease onset. And secondly, on the health status was the 36th item short form survey or SF36, which is a self-administered, comprehensive, and generic measure of health-related quality of life scale survey. It consists of 8 subscales. Each subscale is scored on a 0 to 100 range, so that the lowest and highest possible scores are 0 and 100 respectively. The data analysis done was descriptive analysis, which described the health status of PWMS. The findings of the study is reported in the table as seen in our screen. The descriptive analysis of perceived health status among PWMS. For the subscale physical functioning, the mean was 43.52, role limitations due to physical health 40.57, role limitation due to emotional problem 56.27, energy or fatigue 50.57, emotional well-being 60, social functioning 56.35, pain 52.13, general health 44.18, and health change 57.38. Discussion. The SF36 scores for health status among PWMS in Malaysia reported good emotional well-being, suggesting that participants experience a reasonable level of emotional comfort. This aligns with findings from a study by Denavi et al. 2015, where PWMS reported emotional well-being as a critical aspect of their quality of life. In the context of social interactions, social functioning is good, indicating a relatively stable ability to participate in social activities. This observation correlates with a study of Pokrisco-Dragan et al. 2020, which highlighted the importance of maintaining social engagement among PWMS in preserving their overall well-being. Physical functioning is perceived as poor, indicating challenges in performing daily tasks. Similarly, participants reported role limitations due to physical health, pointing towards constraints in their ability to engage in various roles. These findings are consistent with prior research by Whalen et al. 2015, emphasizing that MS often brings about physical limitations that impact on individuals' functionality. PWMS reported to experience fatigue, which is a common symptom in PWMS and can significantly impact their QOL and overall functioning. Similar findings were reported in a study by Fernandez Jimenez et al. 2020 in Spain, which highlighted the pervasive nature of fatigue in PWMS and its association with reduced physical and social functioning. Pain is a prevalent symptom in PWMS, and the results indicate that PWMS in Malaysia experience moderate levels of pain. This is consistent with other studies conducted in various countries, such as a study by Mark et al. 2017 in Australia, which reported comparable levels of pain in PWMS. The general health domain assesses an individual's overall perception of their health status. The relatively low mean score in this domain suggests that PWMS in Malaysia have a less favorable perception of their overall health compared to other domains. These findings aligns with previous study by Duca-Glaver et al. 2019, which found that PWMS had a lower perception of their general health status. The understanding of health status among PWMS is essential in tailoring appropriate interventions and support systems to enhance their overall well-being. By comparing these findings with previous research, healthcare professionals and policymakers can develop targeted strategies to improve the quality of life for PWMS in Malaysia. To prevent the deterioration of health status among PWMS, early detection and sufficient treatment, either medical or rehabilitation, should be prioritized. These require individuals' awareness of the health and experienced medical practitioners to deal with MS. Family and community support were also important to building strong emotional and psychological well-being among PWMS. These are the references used in the study. Thank you very much for your time.